with people with glioblastoma, and diet and supplements. And one of the main things that she does with glioblastoma is ketogenic diet.
Yeah, so I guess it does matter.
Yeah.
Thanks.
So meat, grass-fed, hormone, antibiotic only. So again, I know there's a lot of controversy in like organic or not organic and thinking about that. Meat is completely different nowadays than it ever was. I mean, cows were not meant to eat corn. They were not meant to be kind of locked in pens. They were meant to walk around and eat grass. And when they walk around and eat grass, their meat is different. Their meat has less fat in it. The kind of fat that they have in it is more healthy and less beneficial, less toxic. And they don't have all these other chemicals. If you're going to feed a cow a bunch of grain that it's not used to eating, then you also have to give it a bunch of other chemicals in order to help it digest and not get infections. And you end up just dousing these animals with all of these substances, which we are then ingesting. So, when you're drinking cow milk or when you're eating beef or doing things like that from just kind of regular run-of-the-mill beef or milk, you're getting pesticides, antibiotics, hormones, all sorts of chemicals that are coming through in those, and you're getting a bad fat profile, like you're not even getting the healthy kind of benefits of what you need. So it's worth, there's, again, like the CSAs, there's places where you can buy a quarter cow, there's places you can get meat. We're so lucky here in this part of the world where we have so much access to clean food and good food that you can get this, and it is more expensive, and if you eat a little bit less of it, but eat better forms of it, you're going to actually be healing your body and helping your body. And then grains, whole grains, again, and an emphasis on non-wheat grains. So wheat in the United States is really hybridized. It has a lot of pesticide use. It's changed. It's got a lot of gluten reactivity, and I know that there's a lot of controversy around gluten-free and the fad, and I'm not a big proponent of all the gluten-free stuff that's available now. It's just a bunch of processed stuff that's using a different grain instead of wheat. But what I do know is that people eating wheat in this country, not overseas, don't see that overseas when they're eating wheat, but in this country can very often not feel well and have a variety of symptoms from it. And truth be told, when I'm talking about diet and we're talking about variety and we're talking about eating a whole bunch of different things, wheat is one of the only grains most people eat. So if you go to a store and you're buying something, almost all baked goods are wheat. Almost all breads are wheat. Almost all pastas are wheat. We have kind of basically created this situation where we're all eating the same thing. And once again, if you feel okay eating wheat, I would still encourage you to expand your horizons and, do some more other grains, including rice, including, quinoa or amaranth, because you'll get different nutrients and you'll get different benefit from having more variety than just eating one grain. I'm about to lose my power. Hang on 1 second. All right, I'm back. So sweets, again, in moderation, because we talked a little bit about sugar and what sugar does. Alcohol in moderation. If you're going to drink alcohol, red wine, you're going to get all that resveratrol, especially if it's organic. You're going to get less of it if it's not organic, and you're going to get more pesticides if it's not organic. And then green tea. This is the green tea plant. And it's got EGCG in it, again, something that you can buy in a pill. It's a pretty potent antioxidant. It really, really helps with detoxification in the liver. It really helps to escort toxins out and get things moving. It interferes with cancer formation in lots of different ways. It actually increases tumor cell death. It decreases the formation of new blood vessels. When you have a situation where you're growing a cancer, part of what's happening is that the cancer needs to be able to grow blood vessels in order to metastasize. So when you can stop that process, you can help stop the progression of cancer. They did a study where they looked at women with stage 1 breast cancer, and those that had 5 or more cups had longer survival and lower recurrence rates of breast cancer, of the cancer coming back. And this is a different kind of cup. This particular study was using smaller Asian-sized cups. You can see there's cup demos there. Green tea is really, it's drunk differently in cultures where they're drinking a lot more tea. You put the leaves in the pot, you pour the hot water in, you immediately pour it in a cup and drink it. You pour more hot water in the tea, on the leaves, you drink it. So you're basically extracting different things as you're kind of pouring hot water on it over and over and over. And, you're having a social experience usually where you're sitting with other people and you're drinking over time. But even without that, we have seen and we have studies documenting that green tea, just drinking green tea, is protective against toxins, protective against cancer. The other thing is spices, and this is something that we sadly don't use enough of in this country, but spices have a ton of protective components in them. And I could probably go through each and every spice on here and kind of talk about what's the different pieces of it. But what I want to say is eat spices and add spices to the food that you're doing. This is a book called Healing Spices, and it's by Bharat Agarwal, and he is at MD Anderson. He's a PhD, and he has published more than 600 papers on spices. He's the #1 guy talking about curcumin, and curcumin is the active component in turmeric. So turmeric is kind of an orange root, and you can actually buy it sometimes at the store it looks a lot like ginger, like it looks like a root. And one of the components in that is called curcumin. And he has now published all of these papers on the anti-inflammatory effects of curcumin, the protective effects of curcumin. And you can see from this diagram, he has listed all the different tumors that it impacts and reduces. And he's actually, as a scientist, he's looked at, what are all the different components of it. And this is what he's come up with, which is these are all different little molecular targets that are happening, and he has pointed out that the curcumin actually impacts all of these. And, in the world of cancer, this genetic piece is happening more and more, where we're studying what's dysregulated, what's happening, what's off, and then we're making drugs that target these different things. But usually the drug targets one of these, maybe 2 of these. And what you can see is here you've got this one component inside a spice and how many things it's actually impacting. So it's somewhat poorly absorbed from the digestive tract. It's helped if you have a little bit of pepper in there, and sometimes even just a little bit of fat. It's anti-inflammatory. It's antioxidant. It really protects against toxins, and it's anti-cancer. It really helps tumor cells. Remember, we talked about being able to kill themselves, in addition to kind of stopping the kind of their growth. So here's the general list of the lifestyle stuff. It's avoid other exposures, drink water, exercise, keep other body systems healthy, no smoking, and reduce stress. So what does it mean to reduce exposures to toxins? Basically, we've already talked about how much the toxins kind of synergize and enhance your risk. So part of the reason we think about the government mandating no smoking at the fire station or in fire vehicles, knowing that you've already being exposed on the fire scene and having that added synergy and added toxin in you. So these are other places where part of what to think about is you're already getting exposed to a lot of things on your job, at your work. So where else can you reduce your exposures, and where else are you being exposed? So what's happening at home? What's happening in terms of plastics? What's happening in terms of other chemicals? What's happening in terms of your foods? We've talked about the organic food. We've talked about the air filter. What's happening with your water? We chlorinate our water. So you're getting chlorine byproducts, in the shower that you're breathing, in the bath. What's happening when you're bringing your shoes into the house and you're kind of contaminating the air quality in your house? Again, before gardening, test your soil. Make sure you don't have lead in your soil. Test your house. Make sure you don't have lead or asbestos in your house or radon. And then, think about your other hobbies, Are you making leaded weights for fishing? Are you playing with bullets? Are you using leaded gasoline? Like, what are your other habits that you're doing? And where are you getting exposed with those hobbies? And where can you kind of reduce your exposures? Drink water. So remember, a lot of these are water soluble. They're not going to get out with filtering the kidney without drinking water. You need to be drinking water in order to kind of filter your blood. You need to be exercising, and I think that's happening, but make cardio, strength every single day, move toxins, move the blood flow around in your body. And then keep other body systems healthy. So like your thyroid, your pancreas, adrenals, your hormones. Make sure everything's kind of working well.
Well, so on that one, how do you do that? How do you know?
How do you know? So, I think you guys are all getting screening. You're all seeing the doctor once a year, at least for physical. Get blood work run. Make sure that your thyroid's functioning. Make sure that they've checked, what's happening in terms of your pancreas and your hormones. Get your hormone levels checked. See what's happening. Adrenal-wise, you're using that, for stress. Pancreas is blood sugar. Check your blood sugar. We're going to talk specifically about different blood tests, but actually checking your other systems and seeing what's off and then addressing those is important because they all feed together, and so they all are impacting the other pathways.
So go in for a tune-up every now and then.
Go in for a tune-up.
Okay.
Exactly.
I know that you get blood work done.
Yeah.
I know, like when we go to Portland Adventist, we get our annual physical and all that stuff. They draw blood, but I've been told that they don't do all the testing that we should have checked. Can you specify maybe what tests should we be doing on our own?
Yeah, perfect question.
Okay.
I'm going to talk about that, I think, in about 4 or 5 slides from now. I'm going to start going through the blood work.
Thank you.
Yeah. So reduce your stress. You guys are working in a high-stress job, and you need to be able to find outlets to reduce that because the stress is producing chemicals in your body. You're getting a hit of adrenaline every time the buzzer goes, every time there's a call. That is it's part of your chemistry. And so part of it is learning how to kind of calm that whole system down. Exercise really helps because it releases a lot of the chemicals. Meditation, biofeedback. There's a lot of programs out there. You can get apps for your phone. You can sign up for little gadgets where you're doing something online. They've got biofeedback ones. HeartMath is one. And HeartMath, you can either have an adapter for an iPhone or an Android phone, or you can get something for the computer where you basically put a clip on either your ear or your finger, and it's monitoring your heart rate with your breath, and you can see it on the screen, and you can basically learn. You can teach yourself to bring it down. You can teach yourself to kind of be really calm and focused. And over time, you can do harder and harder programs on HeartMath, but you can also just learn, and basically you're retraining your body so that you're still alert you're still alert and you're still having these reactions when you're on the work scene and you need to, but you're able to kind of bring it down and calm it down when you don't need to, so that you're not having those chemicals running around your body when you don't need them. Increase happiness. So I know that's it seems obvious, but sometimes we lose the trees for the forest. We just kind of we kind of forget. So, and laugh. Now, I'm going to shift gear into supplements, and I'm going to confess that this has actually been one of my hardest sections to do. And part of the reason that it is so challenging for me to do this is because of the individual nature of it. Every body is different, and everybody's needs are different. Everybody's got different conditions going on for them. Everybody's eating different kinds of foods. Everyone's on different kinds of medications. So trying to come up with like my top 5 supplements of what I was going to do was actually really challenging. And that said, I also want to say that it's important before you start supplements to really have a check-in with your doctor and do some sort of screening blood work, or to let them know what you're doing and have somebody who's kind of following you. Even if it's something that's super beneficial, like we're going to talk about fiber in a minute, even if we're just talking about fiber and you think, well, there's no harm in fiber, and it's true, you're not going to have a single doctor who says don't increase your fiber. Everyone's going to say that's great. But we know that fiber will reduce, your cholesterol, it'll reduce bad lipids, it'll reduce your blood sugar. So if you're on a statin, if you're on blood sugar medication, if you're on something else that now needs to get adjusted, you won't know that without kind of doing some blood work and testing kind of a before and after. So it's important, I'm going to give you the kind of general things, but it's important to think about how this all fits together with you and make sure that you're making a good plan with your team so that you can track things and reduce things, and maybe you don't need those medications anymore.
I guess to put that into context, we've been working on this presentation for some time now. And that's one of the things I asked about was, can we just have a generic recommendation that's probably good for all the firefighters? And so that's in context. That's what Dr. Tolzmann's talking about right now. She was, searching for this top 5. And so I think you still have a recommendation. Is that right? Mm-hmm. But just
there it is.
To put it in context, years ago we had a presentation where somebody gave the recommendation to take emergency and psyllium, as include that stuff in your diet. And I think that's something that several of us still remember. Mm-hmm. So in context, that's kind of what we're after here, something similar to just a general recommendation. And I guess before we get into this, so why do we choose these supplements?
Right.
What is it what we're after with these,
right.
I guess?
Well, so where I went with this was I thought, what is going to give us the most bang for our buck? What am I going to impact the most, and what are the biggest things that are happening? And the biggest things that are happening really are exposures. And so if we're thinking about how do we reduce the chemicals that are in circulation in your body, how do we get those out, and how do we protect your body, that's how I came up with this list. I feel like if you ask me 6 months from now, I might give you a different list, and maybe a year from now, I might give you a different list. And certainly, if I was talking to you individually and found out something else about you, I would very likely change this list. Yeah. Because this is kind of the more generic list. What's missing from this list that's not on here is fish oil, which I actually think is really essential, and we should all be taking some sort of fish oil or some sort of omega-3 oil. We're not getting enough of it in our diets. The other thing that's missing on this list is a B complex, which again, you're burning through your B vitamins with a stress and with your adrenals. So it could easily get added to this list. The other thing that's not on here is vitamin D. And part of the reason I didn't put vitamin D on here was because when I talk about blood testing, I'm going to talk about getting your vitamin D checked, and, hopefully you'll check your vitamin D, and if your vitamin D is really low, you're going to take it. But let me just tell you that if you're not taking vitamin D, it's going to be really low, because that's what we're seeing. It's very low. And the other thing that's not on here is a probiotic, which, we've been able to show that if you take a probiotic, you're less likely to get colds, you're less likely to get flus, you're much quicker to heal from those, you're less likely to get other illnesses, and it changes the way toxins are metabolized in your body. So when you have different guts different organisms living in your guts, they actually change the way those toxins are being metabolized when they come in. So, in some ways, those are all essential items, and I wish I could put them on there. But then I thought, if I make a list of 9 items or 10 items, that's just going to be overwhelming and crazy. So these are the 5 that I did. maybe next time we'll do an add-on and we'll do what are the next 5 and we'll talk about those ones. But for now, these are the 5 that I chose.
Okay.
We'll see if they stand the test of time. So the first one I want to talk about is fiber. And when we talk about fiber, there's actually many different forms of fiber. The 3 I'm going to talk about are rice bran fiber, flaxseed meal, and psyllium. I've put psyllium last because actually many people react to it and it actually makes them more constipated. So if it works for you, I think it's a fine fiber. But if it doesn't, try some of the other fibers. The reason that we need fiber is basically it helps to bind up toxins in the bowel. So the body is the most amazing recycler. So when you have toxins, they come through the liver, they go to the gallbladder, they get stuck in those bile acids, and then they get dumped into the small intestine. Well, 94 to 97% of those just get reabsorbed. They get sucked right back up, those bile salts. And with those bile salts come a lot of the toxins. So if you want those toxins to actually make it out of the body and out of you, you need to find a way to keep them from getting reabsorbed. We're going to talk about a substance that can do that a little bit later, but for right now, fiber actually helps it. So, and again, we've talked about how fiber can lower cholesterol, it can lower blood sugar, it can help prevent gallstones, and colonic butyrate. So butyrate is a substance that the cells in the colon actually need, and they love it, and it helps them stay healthy. So when you have more butyrate, you actually are having a healthier gut. And remember, these organisms in your digestive tract are changing all the time based on what you're eating and what you're doing. So you want ones that are really healthy and healing, and you want good bacteria in there. So then specifically flax seeds, these are these little tiny hard seeds. They get sold in the store either as flaxseed or as already ground flaxseed meal. Flax seeds contain the highest omega-3 oil in plants. So when we talk about omega-3 oils, usually we're talking about fish oil. But flaxseed meal actually has a ton of omega-3 oils. That's the reason the seed is so hard. It's really protecting it from rancidity. It's not going to become rancid if it's got this nice hard shell on it. So when you buy flaxseed meal and grind it up, or you buy it already ground, it comes in a vacuum pack so that there's no air oxidizing the oils. It's a great source of fiber. It helps to decrease blood levels of estrogen. It's anti-inflammatory. It's anti-cancer. And it's actually anti-aggressive in a small breast cancer study. So they did this really small study in Canada where they took women who'd been needle biopsied with breast cancer but didn't have surgery yet. They were waiting to get surgery. And all they did as their intervention was give them flaxseed meal muffins. And the group that got the flaxseed meal muffins, by the time they had surgery 6 to 8 weeks later, they all had tumors that were less aggressive, that had either stayed the same in size or shrunk, whereas the other group, they had all become a little bit more aggressive and continued to grow. So here's an example of how your food impacts cancer, even once you've been diagnosed with cancer. It's not just like a one-way street where it's just growing and growing. You can actually impact how it does that. And part of that is with this, because of the high level of fiber, but also probably the omega-3, which is really anti-inflammatory. So rice bran flour fiber is actually the fiber that's on brown rice. So when you take brown rice and you turn it into white rice, what they're doing is they're grinding the outside of the rice and they're taking all the fiber off. What we know about rice bran flour is amazing at binding PCBs. So it helps to bind the toxins in the intestines, but particularly that fat-soluble PCB that we were talking about, how dangerous it is with the dioxin, etc. It's binding that. It's also binding hormones. It's also lowering blood sugar. It's also lowering cholesterol, triglycerides, LDLs. And remember, rice bran is not the same as wheat bran. We're talking about brown rice. So if you're eating brown rice every day, you're getting rice bran fiber. If you're not eating brown rice every day, then, adding some rice bran fiber is totally great. So when you do fiber and you start with fiber, the key is to start slow. You have choices of either taking it with meals or after meals. People who want to lose weight, they take fiber often at the beginning of the meal or with the meal because it helps to fill you up. It's kind of a big substance that expands with water. Taking it before bed really helps to bind up the toxins at night that are kind of moving through you. And drink extra water. So, here's the kind of goal with your fiber. You basically want to be able to have 2 or 3 well-formed bowel movements every day. And we've moved into poop talk. But you will know if you're moving toxins out of your body, the longer stuff sits in your digestive tract, the longer food is sitting there, the more you are absorbing toxins from that food that you ate. And from the toxins that came in. So you want to be able to titrate yourself with your fiber in order to be able to get to that place. Some people eat a lot of fiber in their diet already, and so they're not going to need to add that much fiber. Some people don't eat a lot of fiber in their diet naturally, and so they're going to need to add more. So I kind of gave you a range here in terms of rice bran fiber, flaxseed meal, psyllium. You can do all 3. You can do 1. If psyllium makes you constipated, don't take it. Flaxseed meal, 2 heaping tablespoons every day gives you about 6 grams of fiber. Start with 1 heaping tablespoon every day and see what you notice. Start with a little bit of rice bran. Take a little scoop of rice bran with every meal and see what you notice. And see how that impacts what's happening digestively. And then adjust it. And like I said, start slow, drink extra water, and just kind of see what happens in your own digestion. Magnesium. So magnesium is a mineral. It's needed for detox, and it actually follows toxins out of the body. So those of you that are exposed to toxins, which all of us are, but some of us more than others, you are magnesium deficient. You will be losing magnesium. And you need magnesium in order to kind of function and actually work and have it take out a lot of the other toxins. If you've had problems with muscle cramps, Charlie horses, waking up in the middle of the night because you're cramping, migraines, chocolate cravings, although chocolate is lovely, and I can't believe I didn't actually talk about chocolate. Chocolate is really good. 70% or higher, great antioxidant. And insomnia can often be all signs of being magnesium deficient. Cadmium, remember cadmium sits in the kidneys, it likes to sit there. That can also lead to magnesium deficiency. And when you have deficiency in magnesium, you're going to end up with these cytochrome P450 enzymes, which I'm going to talk about more in a minute, not being able to work as well and not being able to do their job. So you basically can't get it out of your body. So again, I'm giving you ranges because I think everybody's different. Some people are more magnesium deficient than others. The best forms are going to be citrate or aspartate. They come in lower concentrations, but they're better absorbed than the oxide. Oxide is really poorly absorbed. So even if it looks like it's got a higher amount on the tablet, if it's oxide, you're probably not getting very much in your system. And again, 200 milligrams to 600 milligrams, what will happen if you take too much magnesium is you will end up with loose stools. It helps to pull water into the bowel. So if you're struggling with constipation, taking more magnesium will be helpful. If you're not, taking a little bit less. So again, try and find your range of what kind of works for you and what is helpful in your body. N-acetylcysteine. So NAC is an amino acid, and one of the main things that it helps to do is it helps to make glutathione, which is like considered the number 1 antioxidant in the body. Glutathione is needed to take out a lot of the heavy metals like lead. It helps to get mercury out of the body. It helps repair. It actually helps to repair your liver from damage. This is what's given IV with a Tylenol overdose or carbon monoxide poisoning. They actually give N-acetylcysteine because of the protection to the liver. Again, I put a range, 600 milligrams, 2 to 3 times a day. I think, we're going to talk about a little bit later where we talk about what do you need daily versus what do you need after a fire. And I think you can kind of titrate that based on what you think you've been exposed to. And it's more than just the fires, like there's other exposures that you're having. Vitamin C. So vitamin C helps to reduce pain and increase recovery after exercise. Again, another one with the cholesterol and normalizing stress hormones. It's really important in terms of healing damage from all these toxins, all the airborne toxins that we're getting exposed to. Specifically with heavy metals, it actually helps to get the metals out, and it helps to protect and reverse damage from them. Lead, arsenic, cadmium, there's study after study showing that it's actually protecting the different parts of the body. So vitamin C, again, I'm going to give you a range, 300 to 600 milligrams, which is 3 to 6 grams per day. Buffered, so there's different forms. There's vitamin C, which is basically ascorbic acid. Buffered vitamin C is ascorbic acid bound with minerals to make it less acid. So if you've got some stomach complaints, if you have an upset stomach or tend to have diarrhea, you'll probably want to go to buffered vitamin C rather than straight up vitamin C because it'll just be easier on your system. But it's something that's totally personal preference. You can just play with all of them and see how they work in your body. Milk thistle, again, this is a plant, and it's the main reason I chose it is because it really helps protect the liver from toxins. It helps to regenerate damaged liver cells. It helps to increase glutathione. They've actually given it, so death cap mushroom poisoning is pretty fatal. If you can give milk thistle within 10 minutes, it will completely counteract the toxic effects. If you give it within 24 hours, you will significantly reduce liver damage and brain damage. So it's a really big player. And one of the things that I'm always thinking about when I'm thinking about how do we protect our bodies is how do we protect them but not necessarily aggravate. And some of the liver protector herbs actually can aggravate because they push toxins out. And if you're not ready to have more toxins in circulation, that can be really aggravating. This is really fantastic because it really just helps protect it. It's protecting your liver. Again, I put a range, 200 to 600 milligrams per day. Some people buy milk thistle seeds and actually grind them up and eat them, sprinkle them on their oatmeal or something like that. You can do that too. You're going to get benefit from the milk thistle. So again, this is the summary of the range of supplements that I said. Again, this, you need to personalize this to what works in your body, and you need to personalize this with your doctor and with whatever other medications you're on or whatever else is kind of happening in your body. After a fire, basically increasing all of it. Taking extra fiber, taking more magnesium, taking NAC at least 3 times a day, taking more milk thistle, taking the higher end of vitamin C. And I would say after a fire, part of this is for the length of time that you are aware that you're still processing that. I mean, the conversations that I've had consist of people being able to smell smoke in their urine, in their sweat, in their breath for days after a fire. So if that is actually still happening, you should be on this kind of regime. You're thinking that your body is actively still kind of removing those things from your body. Okay, look, we're on number 3. We're really close. So we've talked about reducing exposures, we've talked about protecting your cells, and now comes the big $1 million question: how do we get this stuff out? How do we figure out what's inside our bodies, and how do we get it out? So the first part of that involves, what's your ability to detoxify? If we can identify that you're actually a good detoxifier or a bad detoxifier, that's going to help us figure out which toxins are in you. Are other systems impaired? We talked a little bit earlier about how the other systems all work together. So if there's something that's not working well, that's going to impact your ability to get toxins out. If you're hypothyroid, you're not moving stuff very well because your whole metabolism is down. And, what are the toxins that are in your body right now?
So an individual firefighter's ability to detoxify then is an important in this question of how to prevent cancer?
Yes.
Okay. So some people detoxify different than others, I guess.
Yes.
All right.
And that's a great question. I'm going to get to it in about 2 or 3 slides. But yes, we are all individuals. We've inherited abilities to be able to detoxify. We've actually inherited toxic loads from our parents. And So yeah, some people are better able to detoxify, some people are not. The same people at the same exposure are going to have different results in their own bodies because of how they can clear or not clear the substance.
Okay.
Yeah. So here's a little diagram of thinking about what's happening with detoxification and elimination. So basically, here the left side is all the stuff that we talked about before, right? Things are coming in from your lungs, they're coming in through the skin, they're coming in through your digestive tract, and everything immediately goes to the liver. Your body is really smart. It's trying to kind of get the toxins out. It all goes through the liver. The liver then kind of figures out how to metabolize it and how to process it. I'm going to talk about that in a second. And then it starts getting it out through your skin, through your kidneys, through your colon, through your lungs. If there's too much coming in, or if you don't have enough stuff to be able to get it broken down in the liver, if the liver's not working well, you're going to end up with excess toxins, and those are going to get stored. So they're going to get stored in your joints, your blood, your tissues, your muscle, fat, bone marrow, liver. And that's kind of what we talked about at the beginning, right? We have all these things, they get tucked away in different parts of our bodies. So in the liver, the toxins come in and they actually go through two phases, phase 1 and phase 2, and then actually are eliminated from the body depending on whether they're water soluble or fat soluble, etc. You need a bunch of nutrients for phase 1 and phase 2 to work well. You need to not have the system be completely overloaded. And you actually need to genetically be able to make the enzymes that work here. And this is something that I think is super, super exciting, and is something that we're doing more and more of, which is being able to look at what's happening individually in terms of your own genes and your own ability to detoxify. So I used to do this testing with other labs, and it used to be $500 or $600, and I used to get these little tiny snippets of basically being able to test what are people's inherited mutations in their ability to detoxify. Then 23andMe came around, which is a $99 spit test. They market themselves as checking for your heritage and basically who you're related to and how much Neanderthal you have in you and where you've come from based on your genes. But what you can do is you can run the test, and then you can download the raw data, and then you can upload it to any number of different sites where they will analyze it and look at different enzymes and look at different SNPs. So a SNP stands for a single nucleotide polymorphism. So remember way back at the beginning when we talked about our DNA and the damage happening to the DNA, sometimes when you do damage to the DNA, it actually changes what the enzyme is going to look like. The DNA is coding for a protein. The protein is usually an enzyme. The DNA is just the recipe. It's coding for this thing that's now going to break down toxins or not break down toxins. So when you have this inherited mutation, we can start to guess whether the enzyme is going to be functioning well or not functioning well based on that. So this is genetic testing. We download the data from there. This is what it looks like when you upload it to this site, which happens to be called Genetic Genie. You end up with this kind of spreadsheet. And what you see on the far left is you see the name of the enzyme, and COMT or VDR. And on the right side, you'll see either a green box with a negative, or a yellow box with a negative positive, or a red box with a plus. And what that's telling you is that that gene, at that particular location, you inherited a mutation or you did not from your parents. And you inherited 2 copies of every single gene, which codes for every single enzyme. You've inherited 2 copies, one from each parent. So if both parents gave you a normal functioning one, you've got a green box. If both parents gave you a not functioning one, you got a red box. And if you've got one in between, you've got a yellow box. So if you go to the second red one, the second red plus, and you'll see that that's MTHFR. There's a lot of information now coming out about MTHFR and what we know about this gene mutation, which results in an enzyme that doesn't work very well. And this enzyme is one that's needed to activate folic acid. This is methyl tetrahydrofolate reductase. It's a long enzyme. It's got many other acronyms. If you look at it, you can imagine texting it and thinking about what someone might think it says. But essentially, it makes folic acid active. And when you cannot make folic acid active, because you've inherited these mutations and your enzyme is now a lot slower, your folic acid backs up. And what we know about that is you have a much higher risk of infertility, miscarriage, heart attack, cancer, stroke, depression. The list goes on and on and on and on. And part of this is because of the perfect storm that we've created where we add folic acid to a bunch of processed foods, and then people have this mutation and they can't actually activate it. And so you end up with a system that's kind of broken. If you eat activated folic acid, which you can take as a supplement, you can actually reverse some of these. If you have an MTHFR mutation, you're also more likely to build up toxins with heavy metals and things like that. So using this genetic data helps us to think about what are your individual risk factors. What are your risk factors for things? It's not a guarantee, and it's not a 100%. So if you go up to the two yellow ones that are near the top, they're both VDRs. That stands for vitamin D receptor. You'll see that this person inherited a positive and a negative for both of them. That means that they have two copies to make a vitamin D receptor, and one of those copies is mutated, and one of those copies is not mutated. When you're making vitamin D receptor in this person's body, which one gets used? We don't know. So, maybe the one that is totally normally functioning is the only one that's getting expressed, and this person has a totally normal vitamin D receptor. Or maybe the other one is the only one that's getting expressed, and they almost always have a mutated vitamin D receptor. So the genes don't necessarily tell us the outcome, but it helps us start looking. So it helps us think, like when I see this on someone, the next steps that I do involve specific blood tests. I now say, we need to track your vitamin D a lot more closely. We need to make sure that you're actually bringing it up because I don't think you might not be able to. We need to check for these other risk factors because you have an MTHFR mutation. We need to now do these other things.
Well, it certainly sounds like a more sophisticated way of looking at things and trying to figure out clues to, what your weaknesses are. I know that I've talked to some of the firefighters about this one, and so there is some concern about predisposition. And can you do this test